The nation's largest health insurer may pull out of Obamacare. United Health says it suffered huge losses since offering coverage on the Obamacare exchanges, forcing the company to now consider an exit from the Affordable Care Act. This could mean much higher prices for consumers who are facing a looming January 31st deadline for open enrollment. Joining me now is Mansa Capital Managing Partner and CIO Ruben King-Shaw. Truly an expert and a major force in the healthcare industry. Good to see you, Ruben.
Thank you. Good to be here.
Thank you so much for joining us. I know you founded this private equity firm, and your specialty is healthcare and technology. I want to get to that in a moment. But what are the implications of this firm dropping Obamacare?
Well, I think it's the confirmatory evidence. What we've said all along is that it doesn't work. The exchanges were a bad idea from the beginning. It was forced onto the marketplace, forced into people's lives, and it's being rejected. It's not working. The numbers don't work. So when the biggest U.S. insurer wants to pull out, that tells you it doesn't work.
Yeah, I mean, you know, you talk to small businesses and they continue to say, we can't afford it. You know, that if I am going to have to, you know, be forced to offer health insurance to all my employees, if I have more than 50 employees, or pay a fine, guess what? I'll pay the fine.
That's right.
Yeah.
That's right.
Yeah.
And not hire the people.
Yeah.
Right.
So it's anti-growth.
Yeah.
But I think it's important to give Ruben the credibility that he worked with Governor Jeb Bush on this, and then was assigned to George W. Bush to help on Medicare and Medicaid. So he has a long, storied history and understands the policies and the implications of this, Ruben, right?
So what would work, Ruben? Thank you for saying that, Bob. You're right.
I think and you see this in Governor Bush's healthcare policy proposal, is that what works is a local-driven healthcare solution. Healthcare is local. It's local doctors. It's local families. It's
so let the states
nurses.
do it.
Let the states, let communities. There are communities across the country that have taxed themselves to finance community-based care. Yeah. Communities who want to do that can do that. You don't need the federal government to do that for
Unbelievable. All right, let me get to some of the things that you're doing, because you have been investing in a number of healthcare-related companies, coming up with solutions to actually make care more affordable. Tell us the focus at Mansa.
At Mansa, that's what we do. We use our understanding of the U.S. healthcare economy to find solutions that deliver superior value to consumers, to patients, for providers, and therefore deliver superior results for our investors. So, some examples. The General Accounting Office is estimating it's going to take $39 trillion to care for the baby boom generation through the end of life. We can't afford that. So we are investing in a company called HealthSense that's using smart technology, wireless, passive sensors, and big data analytics in the living space of a senior to monitor the activities of daily living.
So make sure that they're taking their medicine on time. Make sure that
they're sleeping, that they're toileting, that they're eating. If they're wandering around, that's early onset sign of dementia. And because we get this early indication, we can intervene much more early and save dollars and improve care at the same time.
I mean, one of the big mega trends we've looked at over the years, you and I have talked about it for a long time, is this whole aging in place. Right. So I want to make sure you take care of me with this, so don't throw me out with this big $1 trillion bill.
I will make sure.
Ruben, right? But again, I think this is the conversion of the need and technology, right? And so I think it's very, very important, Ruben, what you're doing is to be able to monitor these seniors in the comfort and security of their home rather than being placed in some remote area.
And for their children. Many children live a far piece, if you say, away from their aging elder. And they want to know that someone's looking after mom and dad and grandma and working with them in a very specific, patient-centered, and with integrity.
And I know you invested in HealthSpot, which was a great story. We had the founders on the program as well. What I love about this story is that there's this massive consumerism going on. People are taking accountability for their own health care.
Without question. One more example of technology being put to use. $560 billion a year is wasted because people don't stay on their medications. Now think about that. 60% of Americans are off their medication within the first 2 years.
They just decide, I'm not going to take it.
The old model was, we'll give you some rebate. We'll create some financial incentives. It doesn't work because they don't want to take them. So we were invested in a company called HealthPrize, which is using consumer behavioral economics, psychology, incentive, gamification, rewards to make people want to stay healthy and take their medication and save money.
That is
And
so fascinating.
if you're going to get paid based on outcomes, if you're going to get reimbursed based on clinical results, you can't get them if you're not taking your medication.
Yeah. This is the kind of emerging technology, no disrespect to all the apps that are being created out there, but I'm personally interested in this.
This moves the needle, of
This
course.
moves the needle, takes care of society.
And you invested in independent living systems
Yes.
is another one.
Yes, great
real
company.
quick, as we end here, if we do see them drop Obamacare, universal health, is that the end of Obamacare? What do you think?
No, because Obamacare is this big omnibus bill, right? So there are other parts of Obamacare that I'm sure will survive. The drive toward outcome value-based payments, for example, will survive. I think some of the innovation around wellness and prevention will survive. I think the Medicaid expansion will either happen or not state by state. But I think the administration has really hitched their star to the exchanges. If that were to go away, you know, they're in a world of hurt.
That's a big issue, big deal for Obamacare. Ruben, good to see you.
Thank you.
Thank you so much for joining us. Ruben King-Shaw there, Mansa Capital.